Good day everyone, my name is Sanchez, BSN2-A, and for today I'm going to perform a bag technique return demonstration. So a bag technique is a tool by which the nurse, during his/her home visit, can perform a nursing procedure with ease and deepness, saving time and effort with view of effective nursing care. So the importance of bag technique is that it may be used to answer um, emergency needs, and at the same time it can perform in a variety of ways depending upon actual home situations, agency policies, as long as the principles of avoiding the transfer of infection is carried out. So before we're going to do the procedures for the bag technique return demonstration, allow me to introduce all of the equipment that is essential for the CHN bag. So let's begin. So the first item or the content of the CHN bag is the soap. We have the plastic wrappers, and also we have the paper wrappers, the paper lining, the washcloth, we have the waste receptacle, and also we have the apron, we have the towel lining, match, pair of test tubes. This is test tubes holders. Let us assume that this is a droppers. We have also a kidney basin, medicine cup, disposable syringe, and also we have disposable needles, thermometer, sterile tongue depressors. We have the plaster. We have also the pack of sterile OS. We have the tissue, and also we have the cotton balls. And also we have these bottles containing denatured alcohols, acetic acid, hydrogen peroxide. We have the Benedict solution, sterile water, and spirit of ammonia. Also we have the soap sud solution, and also isopropyl alcohol 70% solution. We have also a sphygmomanometer, stethoscope, and also the CHN bag itself. So these are the items that is essential for the CHN bag. So after we are already done to introduce all of the content that is essential for the CHN bag, so for this time we are now going to do the procedures. So in doing for the first procedures for the bag technique return demonstration is to place the bag on a flat surface, either on a table, a chair, on the floor with a paper lining. So the purpose of the paper lining is to protect the bag and its content from being contaminated. So with that, I am now going to do the procedures. So I'm going to slightly open the bag, and I'm going to place the paper lining on the table, and I'm going to close the bag again. And then for this time, I am now going to set up the paper lining on the table, exposing the inside portion of the paper bag, or paper lining, because the inside portion of the paper lining is considered as clean. So after we're already done to set up the paper lining on the table, so we're now able to put our bag on it. Okay, after that, we are now going to ask our clients where we are able to do hand washing. So good day, ma'am.
Good day, sir.
Can I ask you some questions?
Yes.
Okay. Do you have a water supply here?
Yes. Inside
Okay.
the kitchen.
Okay. Can I perform hand washing there, ma'am?
Yes.
Okay, thank you. So after we are able to ask for the permission of our clients to do or to perform a hand washing on the kitchen area. So for this time, I am now going to open the bag, okay, and to pick up the materials that is needed or essential for hand washing, like for example the tissue, okay, and then we have the soap, and also we have the washcloth. And then after we are able to pick up the materials that is needed for hand washing, we are now going to close the bag. Okay. So as you can see, so these are the materials that is needed for hand washing. So for this time, I am now going to go to the kitchen area to perform a hand washing. So the purpose of hand washing is to protect our hands and also to eliminate cross contaminations. So I am already done to perform hand washing. So as you can see, I am able to hold the materials that I use for hand washing, wherein um, the washcloth is placed between the double wrappers of the soap. So for this time, I'm going to set it aside here. And for this time, I'm going to explain, okay, the procedures that we're going to do to our clients. So good day, ma'am. So I am here because I'm going to do high blood pressures procedures to you. Okay, so the purpose of this procedure is we can able to determine, we are able to classify if you are anemic, high blood, or you are in a normal state. Okay, do you have any questions about that? Okay, thank you. So after we're able to explain to our clients the specific nursing procedures that we're going to do, so for this time, I'm going to open the bag, and then I'm going to pull out the towel lining, and I'm going to place it or to set it here in the middle of the paper lining, to make sure that the paper, the towel lining is not going to exceed to the coverage of the paper lining, to maintain the cleanliness of the area. So for this time, I am now going to pick or to take out the materials or the equipment that we're going to use. Like for example, we have the apron, and here, this is a waste receptacle. I'm going to place it outside to the coverage of the paper lining. And then we have also the alcohol. Okay, so also we have the sphygmo manometer. Okay, and then after that we have a stethoscope. Okay, and after that I'm going to get out a tissue. Also now I am able to hold a tissue for this time because this is used to clean for the materials that we're going to use. Okay, so after that we're going to wear or to don the apron. Okay, so the purpose of the apron is to protect our uniform and also to protect ourselves in doing a nursing procedure. So after we're able to don or to wear the apron, so for this time I'm now going to do the nursing specific procedures to our clients. So now, ma'am, are you ready? We are now going to do the procedures. Okay. Can I have your facial arms? Okay. Do you drink coffee?
No.
Do you smoke?
No.
Okay, good. Are you relaxed now?
Yes.
Okay, that's good. Are you not nervous right now, ma'am?
No.
Okay. Okay. Please. Just relax. Okay, your blood pressure is ranging from systolic 120/80. It means that your blood pressure status is in a normal state, okay? So after we're able to do the specific nursing procedure to our clients, which is the taking of the blood pressure, I'm going to set all of the equipment that we use in these portions. Okay, so after that, we are now going to clean, okay, the equipment that we use for this time. To clean the equipments with the isopropyl alcohol. And the items that we clean already, I'm going to place it to the first portion or the first dropper. The rationale for this is to maintain the cleanliness all the time by making sure that the used tissue is placed on the waste receptacle. And then after that, I'm going to place it. Okay. So we are already done to clean all of the equipment that we use. For this time, I am now going to perform hand washing. So now we are already done to perform hand washing. So for this time, I am going to return all of the items that we use inside the bag, arranging it in a proper order. So for this time, I'm going to open the bag and return it one by one. Together with the apron. Okay, folding the apron away from me and exposing the inside portion of the apron. Also for the towel lining. Also we have for the soap. Then after that, we're going to close the bags. And I'm going to throw or to dispose the waste receptacle on the trash can. And for this time, I'm now going to carry the bag. And for this time, I'm going to dispose also for the paper lining that we use. Holding it inside or in the center portion, and we're going to dispose it. Okay, now ma'am, we are already done to perform the specific nursing procedures. So your blood pressure is in normal state. And we are going to inform you that we are going to return next week in order for us to monitor if there is a changes in the blood pressure. Okay? Okay. So that's all for the bag technique return demonstration. Thank you.